Spiritual care helps us respond to our call to care for the whole person, body, mind, and spirit.
Spiritual care is truly embedded in the whole fabric of St. Mary Medical Center, from our colleagues to our patients, to their families, to our physicians and our volunteers. The difference that spiritual care makes is truly brings to life our healing ministry of body, mind, and spirit care for everyone, no matter who they are at St. Mary. Spiritual care makes a difference truly in their lives.
I have seen the value of chaplains in many ways. For example, I have been at the bedside of a dying patient when they have held their hand and prayed for them. It has brought great comfort and consolation to the patient and family.
We utilize the spiritual care department very frequently. It is important not only for our patients, but for our patients' families. We all like to treat patients and have them get better, but there are times when the patients don't get better, and this is when the spiritual care department is essential in counseling the families when the patients aren't doing well.
I love the people here, I love the leaders here, and I love the fact that we are serving people in a manner that is above anything that I've experienced elsewhere. We view each person as a sacred human living being, and they were created by God, and we aspire to take care of each person based on their individual needs, not only physical needs, but mental and spiritual needs as well.
I think pastoral care and chaplaincy is a very valuable part of the overall holistic management of the patient, because many of these patients, as you know, have life-threatening diseases and when you're diagnosed with cancer, it brings home the whole idea of one's mortality, and prompts an examination of one's purpose and meaning. And I think that in managing these patients, one has to address the needs other than the physical, that is the psychosocial, the emotional and the spiritual needs of those patients. I think that pastoral care is actually integral to any faith-based organization, and particularly in the Catholic environment, it's vital to our mission.
Whether it be a hug, or when I bring them to Mass and put their shawls around them because they're so cold, I always put them around their neck and they go, and they laugh. To me, that's making a connection. To me, that's the presence of God. When they ask me about God, a prayer, what have you, I always do it. But most of the residents I work with, they just want to be known that they're cared for, and that there's someone there to spend some time with them. And I think that's my role as spiritual caregiver.
Sally is just exceptional when it comes to taking care of the spiritual needs of the patients. Not only the patients, she's very supportive to the staff, the physicians, the nurses and employees of St. Peter's Hospital.
I actually met Sally when I took care of her husband many years ago. We became good friends then, and she took care of us when I took care of her. She continues to take care of the staff, as Alice already said. My relationship with Sally is that usually if I know a patient is going to have a bad diagnosis or is having a difficult time, I'll tell Sally, just go do a la-di-da. And Sally knows that means just go with a piece of paper and pretend like she's just going to go in and introduce herself as a chaplain, and she gets this great relationship with the patient, and then later on she's a friendly face when they do get that bad diagnosis. And she, as Alice said, always knows the right thing to say at the right time.
In hospitals and healthcare systems throughout the country, the focus is typically medical care. In Catholic healthcare, we focus on the spiritual needs as well as the medical care. That's what makes us different. Our pastoral care departments do a tremendous job in ensuring that we meet the spiritual needs of our patients. The pastoral care department is an essential element and at the center of what we represent in Catholic healthcare. It is so important for us to recognize those in the pastoral care departments for allowing us to fulfill our mission as a healing presence in the communities that we serve.
The spiritual care department are such important members of our team. And we always talk about what is so special about Holy Cross, and I believe it's our spirituality. And the spiritual care department are like our anchors. especially in stressful times. I remember one day in a code situation, we were working with the team, with the patient, and unfortunately the patient did not make it. So we started to end the code, and everybody started to walk away from the bed, and in that moment our spiritual care pastor stopped and said to everyone, why don't we all just gather around the patient's bed? And we brought in the family, and we took a few moments to honor this patient's life. The spiritual care department reminds us each and every day of what our mission is, and that is to create a healing environment for our patients, their families, and for each other. They remind us of our mission, and that is to serve with Christ-like compassion.
My first main interaction was with Chaplain Carl. I remember initially when I started here, not too long afterwards, I lost my parents within a month's time, and he was there, wasn't expecting it, but he was there to give some comfort, not only here, but with my family. So that left a good feeling in my heart. So I carried that. Eventually, I started interacting with our volunteers, and in dealing with their personal lives, they bring that peace with them. We become their extended family. And so their problems become ours, and we do this unconditionally. I think chaplain services is an unconditional profession. You're not looking for gratitude. You're there to help. And that's what our volunteers give us. They're here to help.
We had a patient that our chaplain, Molly Garnett, followed for many, many weeks, who was a little preemie baby with congenital heart disease, and she ended up, in the end, passing away. And at the end, the parents felt that they didn't really have any one particular person that they wanted to do the funeral except Molly. And they had felt that Molly had such an integral part in taking care of them as well as their daughter during her hospital stay, that they asked her to do the funeral service for them. And I think that was very special and very, very important.
Pastoral care is a team effort where we work together with the doctors and the nurses and the other caregivers to minister to our patients in their spiritual and physical needs, to help them as they work through this crisis, to know that they're not alone.
I remember one time I was working with one 92-year-old woman who was dying, and she was afraid of death, and she was in bed, and she turned to me and she said, "Deacon Bob, teach me how to die." And it was a very, very moving experience, and I talked to her a little bit and explained to her that God never abandons her and that God is with her always, and just a very moving experience and a very wonderful experience to be able to do that and to hold a person's hand and let them know that things are going to be okay.
Oh, I love it. I love it. I hope I can do it for many more years to come. I love being here at Holy Cross. I feel very blessed, and I feel a lot of guidance from the chaplains. They give us a lot of guidance and help, and if we need anything or anything has taken place, we just tell them and they just take care of everything for us.
At a time when you're a patient in the hospital, it's really, really important to be able to have someone come in and just pray with you if that's what you want, hold your hand if that's what you want, listen, just be one with.
I've been fortunate to be with the Sisters of Mercy, chaplains, pastors, and the wonderful priests who have been part of my care with all my patients. They have been wonderful to the patients. More importantly, as a physician, they've been there to hold us up when there are times of hardship. And I thank every day how they can change the outlook of a patient even when difficult things come, to be providing the comfort. Almost like the mission statement says, Christ-like compassion for all the faith.
The spiritual care here is extremely helpful. This year's been a hard year. Starting off in February, I lost my husband, and we've had 4 deaths in our family since then in the past 6 months. And Sister Barbara and the rest of the team have been really, really great, making sure that I'm okay and just making sure the family's okay. So I've been really well with the spiritual care here at St. Mary's.
Mission services provide so much to our patients and to our staff here. They're kind of the glue that makes everything kind of congeal together for us. They offer the patients prayer and support during difficult times. We have patients that range from just coming in for a screening to getting devastating news that's life-changing. Without the chaplains and the sisters for support, I'm not sure how we as nurses could do our jobs. A piece of the puzzle would be missing in order to care for our patients.
Tabitha is one of the new chaplains, and we had a code in CCU one night, very large family, unable to understand that this person was really going to die no matter what we did. And we continued to code the person until they died. And then Tabitha sat down with the family, and the wife just fell into her arms sobbing. And Tabitha sat rocking her for about 20 minutes until she could begin to accept that her husband really had died. I've also seen some really beautiful, touching moments too. I came around the admitting office one morning, and there was a very pregnant young lady going to come in for a C-section, and Father Muniz had his hand on her abdomen, one hand on her belly, one hand on her head, and was blessing her before the C-section, which was one of the most touching moments I think I've seen here at the hospital.